I was getting my skills off my fingers now. My skills were going up. Thank God I came back to the clinicals because there were some things I do not remember. Like I was to do it. I've been doing ECG. ECG has been coming out perfect. There was this that I just decided, let me not use here. They wrote their right artery, left artery,
Yeah,
and
yeah,
all those things on there. But the color coding was just in my head that
yeah,
night. I've
yeah.
been doing ECG. I just said, let me place the red. I just place colors. In fact, those colors were quite labeled differently.
Mm.
And when I finished, it was like giving like this patient had myocardial infarction. And the two other nurses just came and they rearranged it in that day. When we finished, when we left the patient, they were telling me that they knew this patient should not have symptoms.
That
She
kind of,
doesn't look
yeah,
like someone having symptoms of myocardial infarction.
yeah.
That I placed the right artery elsewhere.
Which anybody can do is not,
You
yeah,
understand? So I was not like, but that we don't use this kind of, but
fine.
that where I came from, in fact, I did not even realize that the colors were the thing that misled me that day. So I was not like, they were discussing. I said, we use the ride your green bike, red, yellow, green.
Mm-hmm.
The person said, oh, that was where it came from. Where you place the red is actually not our red.
Mm. So it was quite different. Not that you didn't know what you were doing,
So
but
I
because
brought my red here, and I think this is the wine that comes here. But still, I have just looked at it because they wrote all those things
all
there.
this
But they
thing,
told me because
and they
I
didn't
just
like
tell me
they
because me
didn't
I've
like
been off the
send you
road for
for
a while.
training. They didn't like send you for training. That, oh yeah, this one does not know anything. No,
And
before
they
you
will
go
now
and
tell
say,
you, but even
but
ordinary blood glucose, if you make mistake of you require the right thing, they will send you for another level of training to make
yeah,
you look like Olodo.
like
No,
a
yeah,
bypass.
it's not completely like that. They just tell you. I know there are people that will still say some things at your back, but at least telling you and letting you know is one thing. You not taking to correction is another thing because some people don't even want to be corrected. If you don't now want to be corrected, then maybe they can step up the concern about you. But if you're someone who loves to be corrected, I think UK is like this for them when it comes to all those apropos. It's because some people want to outshine you,
Yeah.
especially those who are not nurses. If
Mm.
you've experienced nursing, you don't even have the time. You just want the things to be done.
So don't
But
like
those who are not nurses that they brought into their nursing and they are calling them care here, care there, we normally don't use those care something something here.
okay.
You can have enrolled nurse, you can have assistants in nursing, but there are not so many like that.
Okay, there's
I
not
haven't
like
even
support
come across
worker.
any.
Like all those support worker now, you don't have them like we do in the.
Mm. So they do on the ward. I learned they do
So who does all those
their
patients bed baths? All those patients bed bath and changing of bed
I
and
learned
everything.
on the word they do all those things themselves.
They
So
not put.
they have 1 to 4. It will be morning shift to do all those bed bath and all, and it's not all their patients too that needs all those washing and rolling or
Okay.
support with
Okay.
personal care. Those that need, you call the other nurse to help you and you do it and you go. And
Okay.
their wash is not like Niger bed bath that you will put soap
Abio.
and you will scrub
And
and scrub and scrub.
you can even go and bring Gausa Kenken.
So it's not like that. So 1 to 4 in the morning.
Okay.
Let me just say ratio 1 to 4 majorly for day
Okay.
shifts and 1 to 8 at night, if possible.
Okay.
Sometimes we may not have one up to 1 to 8, but it
Bottom
could
line,
be.
the workload will not be is not really as much as that we have in the
No, 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 no. It's not where I am. Not
mentor Shade here has been able to explain to us in details. Thank you very much. Now, let us go into the more serious thing. Now, nursing. Nursing, of course, took you to Australia and you are already practicing nursing there. So now, just briefly, how is the nursing in Australia compared to nursing in UK, especially the workload? Because we know that NHS
okay.
workload, it choke you, it choke. I know you already mentioned that you are working in a very busy place. Where are you working? Let us know how busy it is comparing to the work you have done in the NHS. I know you worked in the NHS for a very long time before you moved out of the UK. What is the comparison? This is the main reason why people move for better pay, apart from that, from workload. Because if you get lesser workload for even more pay or even the same pay, some people can even say, yeah, it's worth moving because nursing is very stressful. So tell us where you work and what
Mm,
the workload.
Thank you very much. So I worked, like you said, in the NHS, and I moved to a more, a non-patient facing area before coming. So I've been non-patient facing for 2 years before coming. So I was a bit reluctant to leave the UK because I can't picture what I will face again. Going patient facing, I tried non-patient facing, but it's like their care here is still different from the UK. So I couldn't have a grasp of that. So I felt, okay, let me come around and have a look at what's actually happening and then try my field again. Then I wasn't even planning to go to the cities for that period of time. I don't think I can survive Sydney
I heard it's expensive.
with their 000 work at that
Mm.
point in time. Not yet ready for that city life anyway. Um, Nursing, we are practicing almost the same thing, except there are some differences. But pinching on workload, as per
Yeah.
you said, the home of my hospital is a community hospital. I know there are community hospitals too in the UK.
Yeah.
46 bedded hospital, including our ED, ward,
Wow.
theater, and delivery room. So everything comes around to be 46. I
Okay.
mean, I'm an emergency nurse now,
Ah,
emergency department is where I'm working. And
wow.
then we have 6 couches altogether.
Okay.
And since I've been around, we haven't had the time that we fill those 6 couches at the same
Ah,
time.
please, so I'm not hearing well. Just six. Wait,
Yeah, it's a community. We are not big, but that's
even
what we
six
have.
is too small. Eh? Ah, how many
That's
nurses?
so per shift, like in the morning, you can have as many as 5. You
Ah,
can have
so
the
not
list
six
of
patients.
3. You can have 3. You can have in the afternoon 3. At least you must have 3, 3, 3. Three in the morning, 3 in the afternoon, maybe possibly 2 at night.
Okay.
Because I was shadowing, so I was working nights and we were free. But we'll be shifting to 2. But if we're shifting to 2, I know we still not break anything from me because all this why we've been, I think the maximum we've had on night shift will be like 3, and it's not like all the 3 will be on with you all through the night.
Oh,
You
you
know, emergency department, you are moving them
transfer them.
once they are fine.
Mm.
Or is it that you move them to the ward or you move them back to care where they came from, or you send them back home if they are comfortable. You've done their triage, you've informed the doctor who sees them, and after seeing them, then they give them whatever they want to take and they go back home. Like last time, there was this guy who came with tonsillitis. We've seen him, and after the doctor saw him, they just gave him medication and he went back home. So that is not
Oh,
part of our people on the bed. We
okay.
had 3 patients through the night, but they came at different times.
Time.
And we moved 2 out before the day broke. And as the day was breaking, we were already planning to move the third one already.
So it was
One
practically
went
like
back
empty.
one went back home, one went back to care home, the other one will be going to the ward the following morning. We've handed them over. If you're handing over from our EDs, the people on the ward that will come over to the ED to take over the patient and carry the patient
Wow.
to their ward. So we don't in our ED carry
You
patients
don't
to
even transfer. Wow.
we don't move around them. You just give the handover, they come around, check on the patient. If it is the we've admitted a pregnant person too. As the
Wow.
person was coming, their midwife was actually coming too.
Oh.
So we admitted, we assessed,
Ah,
we do the
hey,
CCTV,
Australia
and
on my mind, yo, my people. Australia on
yeah,
my
I'm sure it won't be like this in the cities. Cities are
Okay, yeah,
busier.
that's the next question. At least I'm sure you have friends in the city and everything. How do they
Mm.
see it? Still, is it like it's very cumbersome like the UK? Because the UK,
It's busy in the cities. Like I met some travel nurses. 3 of them they
okay,
just finished last Saturday and they've gone now. And they
okay,
were saying they do go work in Sydney, and 2 of them were going back to Sydney. One is going back to another territory, and they said it's quite busier there, but that you have everything on ground.
on ground.
So
Mm,
when they still say you have everything on ground, I look around, there hasn't been anything that we needed since I came that we never sought, that
mm,
we're unable to use. So it's busy in the little way, but not like the busy of the UK.
mm.
You
Oh,
can't even
right.
put
Ah,
them at par. You
ah,
can't bring them close at all.
Even the ones in the city, like what you are saying, even the ones in the city have not, like, you don't think the city business is still see as much as the
Yeah.
business in the common
I've
NHS.
seen someone who said the patient stayed like 3 hours because before they could see doctor in the city. Maybe that wasn't an acceptable one to like what we had in the UK. But it's triage. They would triage the case if it's a case that will wait. And
Yeah.
they have cases that can't wait. Definitely they will put those ones as priorities. But even as what I've
Yeah, but
seen
three
so
hours
far,
is not too much for ED now. Me, I've been to the ED in the UK and I waited 9 hours and I wasn't even attended.
so it's not that bad around. It's not that bad. But if you're in the city, you'll be much busier than where I am.
Obviously,
But still,
not as
not
bad.
close, not close, because we
So,
do talk about it on our different platforms. Not
okay.
the same at
So,
all.
so for people, I'm sure you have friends that are on the ward, not ED, like patient to nurse ratio on the ward.
One to four in the morning, 1 to 4 in the morning, maybe some 1 to 5 occasionally in the afternoon. Like what I see there, that ward has 20 beds.
Okay.
So in the morning they have 5 nurses.
Okay.
In the afternoon, I see them having 3 or 4. In the night, they should have 3.
Okay. Okay.
So if they are not having 3, then there is a way they will reduce the number of patients they take into the ward.
Okay.
Yeah. So in most situations, if they do not have 3 nurses, they will have 16 patients max on that
Okay.
night
So
shift.
each person will
It-
take at least 4 of.
At night, it will be 8 if they don't have 3 nurses.
Okay.
So if the one person to 8 patients at night, and
At
what are
night.
you doing at
Okay.
night, sef, as such? If we have such situations and our ED are not full, if we have such situations, we hold patients in our ED.
Okay.
What
So,
we do, ED beds are not just that comfortable. We request for bed to be moved to us, comfortable
okay.
bed, and we put the patient and we nurse them so that we don't belabor the. Here is where
Okay.
everybody is thinking or how everybody is comfortable at work.
Okay.
You
Okay.
understand?
I get.
I saw something and it really touched me. There was a day we were to take a patient. The first time I saw that we could actually bring in comfortable bed to my ED, there was that case that was ready for the ward, not for home. But
Mm.
because they were short, my team lead was like, "Oh, we don't want to stress them on the ward. So what we do is
Not the
bring in." So
wow.
we brought in a bed and all that. And the guy was quite calm. It was a mental health case and all that, but that should be on the ward. They said, no, we don't want him to maybe he turned around and have symptoms and want to do some other things at night. We don't want that to happen to them because they don't have enough hands. And I was thinking, if it were to be where I was coming from, we just want to push out.
Yes,
Okay,
now
let it become their
obviously,
load.
yeah, because they are still
Uh-huh.
coming too. There are so many people coming. They cannot afford the ED to be like, yeah, I understand because there's a lot
No,
of
the issue is that some people even jubilate that we were able to push that person to them,
yeah, it's very
not
stressful.
considering what is. So I was so happy. And here at ED, where I'm working, a patient is coming. Of course, they could say you should pick that patient, but as they are telling you to pick, 2 other nurses are coming around you to take care of
So
that same
thank
patient.
you.
So
Wow.
the patient that is coming is not for you alone, it's everybody's patient.
So it's a teamwork. Is very good.
It's
The
a
team
teamwork,
spirit
and
is
that's
there.
something I really cherish. And I think I witnessed that last in Nigeria,
Mm,
where your patient is everybody's patient. It
yeah.
doesn't mean you should laze around. In fact, you'll be ashamed too if you are lazing around now. You see yourself as
Yeah, because then
irresponsible.
some people are very suffering, like having all the patients, and some people are chilled. Although most times in the NHS, everybody is busy, so nobody to even help you. But at least that team spirit is there. Although there are sometimes some people are good, everybody just minds their business and everything. And
Yeah.
that now takes me to the next question. How friendly are the Australian people, especially your nurses?
Forget about friendliness. So you cannot compare them with those who are
Is
giving
it,
you
you know
plastic
what, is
smile.
it all those like short, looking for ways to go and report it to the
Definitely
manager?
everywhere. There will always be cho everywhere now. You too, if you have opportunity to lie, say you not lie somebody.
It's part of
So
life. That's what makes life. But you know all these ones. Let me explain with you because me, my eyes saw shaggy when I really started working in the UK. I said until I began to understand them. You know, some people
UKO is on
they will
another
just be
level. Those
looking at
guys
you as
have
if
no
you don't have
work.
common sense or whatever. You do any kind of mistake, they can even turn you to. I even still heard of a case that someone is still telling me, I think 3 or 4 days ago, that they turned this person into supernumerary because she wrote skin intact instead of like you did not check the skin. And so many people write that, although we know it's not good, but I don't think that you now turn that person to supernumerary for 2 good months just because the person wrote skin intact. Said, oh, you did not check the skin, you were supposed to check the skin and write the state of the skin. And that is how that person met it there. That is why they have been doing it. They are always to correct people. You put the person on supernumerary for. So when I was working in the NHS, I've had God. I don't know how God saved me. There are some of my colleagues that just one little mistake, they will put them for supernumerary. They will announce. They will somewhat traumatize you. You will do anything or you ask questions. For example, oh, how do they use this thing? Not like we are dumb. We have those. It's only equipment that made us suffer in Nigeria. But I'm telling you, we had intense nursing education. So you now ask more question like, oh, this equipment is different from like now, maybe the lift, the hoist or something. And then next thing you are hearing is that she doesn't know how to use the hoist too. Don't make her use it again. No. And everybody is saying,
So
is it like that here?
I've had some experiences that were not so funny to me because I was like, how did I come here? Jesus. See, on the watch, here, our sliding sheet. That's
Yeah,
what it should be.
yeah,
It's like double. I don't know of your word of
yeah,
your unit, but in my unit in the UK, it's like double like that.
yeah, yeah.
It's double. They've sewn it in double way.
Mm,
Here, when they said I should bring sliding sheet for this patient, I brought the sliding sheet. I saw it was open. Mine was telling me, but this thing supposed slide on each other now.
yeah,
Why is you like? So it did not even cross my mind to fold. I
fold it.
just pushed it. So the lady just said, "Oh, when we finish, we just use it." She didn't say we should not use it. She was
Yeah.
not like, "I should fold next time this and that." And I was like, I was thinking about it that this
Mm.
thing is called sliding sheet because before it should slide on each other.
On each
But
other
I've never seen this open sliding sheet. All
before.
I've seen is the one that comes as
Oh,
double, and you finish and you pull the one underneath to drag it
yeah,
out of the patient.
outside. Yes, that's all.
You understand? If it were to be the UK, I'm sure they will go and say she doesn't know
She doesn't
anything.
know, and she
Like
said
in my
this.
head,
That's
I
what
was
the
thinking, okay,
UK.
I was getting my skills off my fingers now. My skills were going up. Thank God I came back to the clinicals because there were some things I do not remember. Like I was to do it. I've been doing ECG. ECG has been coming out perfect. There was this that I just decided, let me not use here. They wrote their right artery, left
Yeah,
artery, and
yeah,
all those things on there. But the color coding was just in my head that
yeah,
night. I've
yeah.
been doing ECG. I just said, let me place the red. I just place colors. In fact, those colors were quite labeled differently.
Mm.
And when I finished, it was like giving like this patient had myocardial infarction. And the two other nurses just came and they rearranged it in that day. When we finished, when we left the patient, they were telling me that they knew this patient should not have symptoms.
That
She
kind of,
doesn't look
yeah,
like someone having symptoms of myocardial infarction.
yeah.
That I placed the right artery elsewhere.
Which anybody can do is not,
You
yeah.
understand? So I was not like, but that we don't use this kind of, but
Fine.
that in where I came from, in fact, I did not even realize that the colors were the thing that misled me that day. So I was not like, they were discussing. I said, we use the write your green by red, yellow, green.
Mm-hmm.
The person, oh, that was where it came from. Where you place the red is actually not our red.
Mm. So it was quite different. Not that you didn't know what you were doing,
So
but
I
because
brought my red here, and I think this is the wine that comes here. But still, I have just looked at it because they wrote all those things
all
there.
this
But they
thing,
told me because I
and
said, just tell me
they
because me,
didn't
I've
like
been off
send
the
you
road for
for
a while.
training. They didn't like send you for training. That, oh yeah, this one does not know anything. No,
And
before
they will
go and
now
do
send
again.
you for even
But
ordinary blood glucose. If you make mistake of you require the right thing, they will send you for another level of training to make
yeah,
you look like Olodo.
like
No,
a
yeah,
broadcast.
it's not completely like that. They just tell you. I know there are people that will still say some things at your back, but at least telling you and letting you know is one thing. You not taking to correction is another thing because some people don't even want to be corrected. If you
Mm.
don't now want to be corrected, then maybe they can step up the concern about you. But if you are someone who loves to be corrected, I think UK is like this for them when it comes to all those apropos. It's because some people want to outshine you,
Yeah,
especially those who are not nurses. If you've experienced nursing, you don't even have the time. You just want the things to be done.
They don't
But
like
those who are not nurses that they brought into their nursing and they are calling them care here, care there, we normally don't use those care something here.
okay.
You can have enrolled nurse, you can have assistants in nursing, but there are not so many like that.
Okay, there's
I
not
haven't
like
even
support
come
worker.
across any.
Like all those support worker now, you don't have them like we do in the.
Mm. So they do on the ward. I learned they do
So who does
their
all those patients bed baths, all those patients bed bath and changing of bed
I
and
learned
everything?
on the word they do all those things themselves.
The
So
nurses.
they have 1 to 4. You know, it will be morning shift to do all those bed bath and all, and it's not all their patients too that needs all those washing and rolling or
Okay,
support with
okay.
personal care. Those that need, you call the other nurse to help you and you do it and you go. And you know
Okay.
their wash is not like Niger bed bath that you will put soap
Abio.
and you will scrub and scrub
You
and
can
scrub.
you can even go and bring Gausa Kenken.
So it's not like that. So 1 to 4 in the morning.
Okay.
Let me just say ratio 1 to 4 majorly for
Okay.
day shifts and 1 to 8 at night, if possible.
Okay.
Sometimes we may not have one up to 1 to 8, but it
Bottom
could be.
line, the workload will not be is not really as much as that we have in the
No, 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 no. It's
oh,
not where I am, not as terrible as that. And when you
okay.
know one of the things I used to say, because some of these people that dragged me to this village were already in the UK before, I would just look at it and say, for you, at least I've seen you twice. You visited me. The way you are glittering, the
Ah,
way your face is shining, and it's like that. I
wow.
got to church my first time in the church. I was just looking at people's forehead. You know, it's a different
Wow.
ballgame when you are
If
looking
you are
from the
not
screen.
stressed now, if you are not
But you
stressed,
are
you
looking
look
face to
nice.
face. You see
But
these
when
people
work has killed you, you will look like an old woman. So
and you
that
are
means you
not
are not
emotionally traumatized. To some people are
traumatized.
not, but the way they traumatize people emotionally in the UK is
It's
another
too
thing
much.
to
So this
study.
person I was telling me, I say, this all this one is not there. Even go and meet somebody for roaster. The person is saying I cannot do me. Yeah, I do my roaster myself. Sometimes, like this is the first time ever that they've actually changed what I put in, and they explained that the roaster was very shitty, and they had to just put it. And I still told, I said because of childcare, I don't think I can work on these days because I did not put myself there. When I spoke to the manager, he changed this completely. I said we don't want to cause any childcare issues for you. We know you have to work, but we don't have the, don't worry. That means those shifts you cannot do, we'll put it out as extra shifts for people to pick up. And change everything entirely for me. No, that one I will go and see manager. They will say there's nothing they can do to it.
Because they are short,
There's no
extremely short.
problem that they will help you find solution. We have
They
done it.
don't.
There's nothing we can do to it. So really, being traumatized, really, really, honestly, we have all those things too that they do in the UK here. But I say for UK and this year they are still learning work. But like one of my friends was complaining that they did something for her in the year in our ward and everything. I said, all this what you are saying, I beg, use it like soap and dust your body. Because if I tell you what I saw in the UK, this one is still learning work. I said,
Yeah.
if you want
And my manager has been to my house twice. Of
you
course, we are a very small community. I won't expect that a manager of UK world should go to people's houses, but
wow
that's a level of communal love.
relation.
My facility manager, which is the head nurse of the whole hospital, has been to my house once. That day we
Wow.
were to have a meeting. She said she would come to visit us in my house, but I had something to do on the ward. That was the day I said I would go and resume on the ward. Let me
Oh,
start seeing what's going on. She after seeing me in the hospital, she said, okay, I will still go home and visit the family. She came, and that
wow.
woman is 73 years old.
Wow.
She came and still had a chat with my people. The day I came, it was a manager of a ward that came to pick my family from the airport with van. And as we were getting to the hospital, my manager was elated. She pulled her car and came to my house. They were the one lifting the loads. If I didn't touch any bag, it was when my husband saw them pack it down. My husband rushed and joined them. When
Wow.
we came, when we've done interview, how many children do you have? They ask for their names. Next time you are
Wow.
having meetings, they are addressing you with the names of your children, like asking you
Wow.
how is so child, they will name the child. How is so child, they will name the child.
Wow.
They will name the child.
That's
So,
very mindful.
and
Very
yeah, they're
thoughtful.
very demure.
Very
When we came,
demure.
and when we came, they've organized gifts on the table that correlates with the age of the children and named the gifts.
Hey, my people, Australia is calling you. Hey, this one.
I don't know how it happens in other places, but that's what
Wow,
I've experienced so far.
that's a good one.
And
Lovely.
the moment we finished, my manager just said, let's go to the shop because we need to pick milk and egg. And she paid the $51 for that. I kept running after her to give me her account so I can pay that money. When she saw that my wahala was too much, she eventually gave me the account last week.
Wow. So not like she wanted the money, but you as a Nigerian person, like, hey, let me pay back.
And that night she said, maybe we should come to her house for tea. I said, thank you. We very much appreciate this. But then my people have already prepared local delicacy for me.
Nigerian food, Laro for
Hey,
you. Wow. Okay,
Jesus.
let's moving forward. Hey, that's lovely. Hey,
It
Australia. Hey,
is.
that's lovely. Moving forward, the only another thing is that this your 8 hour shifts, like I heard that they.
Hmm.
How are you finding it? Because some people
Well,
are so used to the at least I work for 3 or 4 days, I'll have my long day off. Now with the 8 hours, it's just like Nigerian kind of system. You have to work for 5 days in a week. How are you finding it? Do you think because some people say, I don't think I can do that kind of thing, or working 5 days in a week. How do you feel about it? Do you feel it's not like
so, me, I've always loved the 8 hours. That 12 hours, and I die for that UK. It's only because I don't get choice. And I reduced my hours because we had
yeah,
flexible shifts
in when we were working
opportunity
for
in
NHS
triple
or
one, and I
whatever?
was working 10 hours at night. And
Yeah.
it is that same rota that I'm working here.
Oh,
When I came, they've had meetings. They said the New South Wales government said if you have childcare responsibilities, you can reduce your hours, you can go on flexible shifts. And
wow.
I really met people on the board that are only working for 2 days in a week.
Wow.
Aha, I have people like that. They don't pressure themselves like that. Maybe they are doing some other things as well, I don't know. But I
Oh,
have people that are working so just like that. So me, I'm working just 3 nights.
oh, okay.
And I asked my manager to put me on alternate Saturdays day shift. So at least I can see Osanle, I can see the afternoon of the city, no be say na only the dark of the farmer they see. So not bad on me, but people who love long shifts may not really like it. Still
Okay.
at that, the people on the world are not having it badly. I even see person that said because the person said they were doing 6 6. Then I said, well, how are you doing that? Because normally if you are doing your 8 hours, you shouldn't even be doing 6 days. She said, what will she be doing with our time? If she's extremely tired, will she be doing 6?
Honestly.
But for her, constant case, she should be up. Most of our people here go off on Sunday. Most of us who are Nigerians that go to churches, we go off on Sundays and they are happy because you can double your money. So people that work just one day, they come on Sunday and they double their money. Now we they give the
Yeah, they
sacrifice.
double
They
their
don't,
money.
but I don't think people are having it badly. People are not
Badly. If
having
the
it
work is not
badly.
stressful, really, at least
Mhm.
if you
I
work
don't
8 hours every day, you still have that strength to come back the next day.
I'm
So,
sure cities will be much stressful than that. I'm
oh,
sure
mm.
cities will be much more stressful than that.
Okay, ma.